Not giving your dog high calorie, high fat treats.
Is surgery ever an option? They don't care how much pain they're getting. They got to get to the food bowl. They got to get to your, they want to go chase the ball. They want to do whatever. You get the bone on bone, and it's no fun for those guys. Just underwater treadmill for dogs, and they can raise and lower the water level to decrease weight bearing. I've seen cats doing it. It's crazy with the cats in the tank. Cold laser therapy, those kind of things were good for joints and tendons. What are some of the best ways to treat joint issues and or hip dysplasia?
I think some of the best ways are non-steroidal anti-inflammatory drugs, your Rimadyls, your Galliprants. I use those a lot for prevention and continued treatment for dogs who have established arthritis or dysplasia. Joint supplements, and there's the brands that I am familiar with, I'm comfortable with, will often recommend would be like Dasequin, Cosequin, Glycoflex, Vicox. There's I'm just looking at a list right now, but those are the ones that I've used in the past. There's a bunch of other ones with trademarks. But yeah, so glucosamine chondroitin supplements, or what I just mentioned. But yeah, I would say that. And then, not giving your dog high calorie, high fat treats, looking at the diet, maybe considering a therapeutic diet that has some glucosamine chondroitin in it. Il's JD is a good one. Like healthy treats if you're accustomed to, and that's what your dog likes, that has antioxidants, blueberries, turmeric for anti-inflammatory properties. Yeah, just like stuff like that. Those are ways that I would say. Those would be like the non-invasive, medical supplement, medical route of helping things out.
So is surgery ever an option? Let's talk about some invasive treatments for hip dysplasia.
Yeah, it is. It's something that, I'll be honest, I've never actually done myself. We save that for the orthopedic surgeons, and I would love to hear about, if you could speak to, your history of being involved in some of the FHOs, total hip replacements, TPOs. There's all sorts of different procedures that can be done based on how young, usually for puppies is when I would say a lot of these are good for, and it will also depend on the dog's weight, and if it's a large breed dog and has good 50-60 pounds, that's kind of riding on that joint, because really the weight bearing axis is such a fragile thing. Sometimes if I do something to graze my toe and I just kind of hurt a little part of the nail or something, it actually makes a big difference on how I walk.
Right.
And it's this shouldn't be this really shouldn't be, but there's a good amount of weight right down on that side of the body, and it really I feel whenever something bad happens to me, my cat bite cellulitis, which, check it out, looks awesome.
Yeah,
a little bit of a scar, but fully functional.
You're a vet, you have to have scars, so yeah,
you gotta have scars. Yeah, from bears or cats. But essentially it makes you really appreciate how delicate the system is. And so yeah, I've never done a surgery. I have recommended certain patients who kind of fit the criteria and are young enough and maybe lean and not heavy enough to undergo these procedures. And yeah, this is kind of where I leave it to you, because I kind of just, refer to the orthopedic surgeon for those cases. What has your experience been with those?
We did a lot of, FHOs, the femoral head osteectomies, where you just basically just remove the femoral head. You know that. I'm just letting everybody know. And that seems to work pretty well. Depends on the size of the dog. We've done it on little dogs and big dogs. The TPO, the triple pelvic osteotomy, it's mostly younger dogs. I think we did those on. I scrubbed in on a few of those. There's not much for me to do, retract this, retract that. But they had special plates made for those little stepped plates that you could put on, and the dogs did pretty well. But we've seen hips to the point to where the poor femoral head is just flat, and the acetabulum it's just like this, basically. It's supposed to be like this, and then this is spread out, and that's just flattened out. And you feel for these guys, because it hurts. And and dogs, especially the ones that you said get this more often, the labs and the Goldens, and nothing's going to stop these dogs. They don't care. They don't care how much pain they got to get to the food bowl. They got to get to your, they want to go chase the ball. They want to do whatever. And when they're having a hard time going up and down the stairs, or they're, it's time to get up, and it's like, they're just trying. They're trying so hard. You feel terrible for them. But yeah, we've done a bit of surgery on those. But when it gets to the point where it's so gone that you can do an FHO at that point and just take off what's left, and you get the bone on bone, and it's no fun for those guys. Would you recommend animal rehab for some of these guys, for swimming?
Yeah, that's for sure something that, sorry that, we're only mentioning just now, but those are actually really, really good things. I think that can't be understated. I worked at one practice in Boston that did have hydrotherapy, the underwater treadmill, and that's awesome. I think, that's just such a great thing. Definitely helped me when I had my orthopedic woes, my ACL surgery, a little bit after the surgery, when kind of the scar tissue, you can't just go immediately after. But for sure, I think with or without surgery, that's a really good thing to kind of help with, muscle mass and kind of taking the weight off of a dog. And so kind of a couple times a week having some sort of, if that's an option in your area. I think it may be a little limited, but for sure, hydrotherapy, massage, stretching at home. There's a lot of, I'm sure, YouTube videos of kind of showing owners kind of how you can do that. I think it's a great way also to just bond with your pet. It may offer some comfort, and you kind of get to know their body a little bit better. Might feel a little bit awkward at first, but I think, those are really good alternative modalities for therapy.
Yeah, I think the rehabs are popping up more and more. It's becoming a little bit. It was kind of like, but now it's the place I used to work. We had a rehab facility in house that shared a space with us. It was a separate business, kind of under the same umbrella. But if you go to an orthopedic or a specialist, if they hopefully will have a relationship with a place like that they can send you to. My dog had the underwater treadmill. Is amazing. If you guys want to look up on YouTube, just underwater treadmill for dogs, and they can raise and lower the water level to decrease weight bearing. I've seen cats doing it. It's crazy with the cats in the tank. Cold laser therapy, those kind of things were good for joints and tendons. And my dog's got a little bit of a tarsal issue, so it's good cold laser on that. And she loves it. She's a golden, so she likes the water. and she goes right in the tank and just goes to town. I've seen where they smear peanut butter on the door of the tank, so the dog has something to look at and something to encourage it. Because sometimes they'll just stop and they just go to the back of the tank and smack the back wall. It keeps them actually moving and motivated to keep moving. So in terms of, we talked a lot about hip problems, and that's certainly, I think, the most common. In terms of, elbows or the wrist or the carpus or the tarsus, anything like that, in terms of arthritis on those joints, what are some treatments that you could do for those other things that maybe aren't as popular as the hips?
Aren't as popular as the hips? I mean, I think a lot of what we mentioned is also very applicable, in terms of NSAID therapy. I guess it really depends. Like, one of the other things that we didn't really touch on here would be the degree that trauma plays in degenerative joint disease, and whether it's a one-time thing. My friend Brooke's dog, Duke, beautiful little dog. I have no idea. Like, we have no idea. It's a Maltese, poodle, Cavapoo, something. He's adorable. She got him, and the very next day, he actually jumped off the couch and broke his radius and ulna. And then got his surgery. Doing fine. After it's been like a year or something since then. But that is, and luckily it was like mid shaft, not at the growth plates or affecting any carpi or carpal bones or anything. But things like that, or jumping out, if a dog jumps out of a car, or dog keeps landing on a specific part of, especially in the forelimb, or the elbow, as you mentioned, the fractured medial coronoid process, or there's like the ununited anconial process that young German Shepherds can get. There's all sorts of things that can, get bumped into, or, jump wrong or land wrong. And that kind of little micro trauma events, stack up, and in time, you do an x-ray, and it's not the hip joint, obviously, so you're not seeing any dysplasia, but you are seeing some little new bony growth and maybe a microfracture, and that could be something that is hurting a joint in the forelimb, as you mentioned. And so I think the very same applies depending on the degree of the fracture. Is it comminuted? Is it clean? Do we need to surgically fix this, splint it, rests, NSAIDs, joint supplements, long-term. Those are all very real things. And then, like you mentioned, the cold laser, photobiomodulation, all sorts of new things these days. But those are big ones to consider.
I think it is worth noting that anytime you mess with a joint surgically or there's trauma, there's going to be arthritis. Your body's gonna, people would come in with a cruciate tear and it's like, oh, but my dog's got arthritis now. Yeah. It's like, yeah, because you're going in and you're messing with stuff, and the body it gets inflamed. Yeah. The body doesn't like that, which forms the arthritis.
Inflammation of the joint, arthritis.
Yep. So what about like stem cells?
Yeah. I have not personally done that, but I know that. Wow, it's just taking me back to what rotation was I on? Back to vet school. I do remember that we did some of those intra-articular injections. I'm forgetting right now that off the top of my head the specific acronym, but I do recall one of the radiologists performing that injection. It'll come to me as soon as we're off this.
I'm sure. Yeah.
But yeah, that would be something to consider.
Cool. Well, I think we need to wrap this up before the before it craps out again. So, any kind of parting words you want to leave everybody about hip dysplasia, arthritis, joint health?
Yeah, what would I leave owners with? Sometimes when you see it. Like, I was biking through Central Park yesterday. I saw a guy walking a German Shepherd, and how some of them, they just like their back end is like that.
Mm-hmm.
It's like stereotypic. It doesn't always have to look that bad to be hip dysplasia, but if you do have a large breed dog, or any breed dog, really, who may be overweight and maybe a young puppy or not, but is having hind limb trouble, bring him to your vet, and he or she will be able to discuss with you, options for diagnostics and treatment. And x-rays can be expensive, like, totally understandable. That's one of the kind of hindrances that I think I run into a lot, where, you may not want to kind of, do that, and it's understandable, but there is a lot of value and utility in making a diagnosis, even early on. And it's not like a death sentence that this is something that your dog will have to live with these symptoms related to hip dysplasia for the rest of his life. We can make a diagnosis potentially fairly easily, and then work with you to develop steps on how to go about treating it, or preventing onset of really bad problems.
Excellent. Well, before we go, I wanted to let people know they can get $10 off natural dog vitamins if you go to rockwellpetspro.com and enter the code senior before they check out. Well, Dr. Max, it's been a fun week talking about hip dysplasia. We will be back next week at 7 p.m. on the same Facebook and YouTube. And who knows what we're going to talk about next week? We will find out probably next Wednesday. Have a good night. Have a good night there, Dr. Max.
You take care, Mike.
Hey, if you like this video, don't forget to like and subscribe to the channel and share it with all your animal-loving friends. My name is Mike the Voice Monkey, and we will see you this week with Dr. Max on Ask Our Vet.